In this video, we aim to clarify how the concepts of empathy, understanding, communication and rapport all fit in to a patient-centred consultation. Welcome to Consultations for Health, helping you to improve your communication skills to optimise the care of your patients. The ultimate aim of a good patient-centred consultation are patient satisfaction and improved health outcomes. However, there are many considerations before this result, which we're going to try and clear up. Building rapport and achieving empathy require the use of specific skills, some of which we've addressed in previous Consultation for Health videos. Some of these skills are complex and you may have to practice or continue to work at them to achieve excellence. You will need to be reflective of your own practice to help you to figure out where there may be some gaps in your skill set. This will be important because although you may have the right intentions and feel very motivated to help your patients, it may be that you're not using quite the right set of skills in the best possible way. This is where empathetic accuracy and empathetic skill comes into play. When we talk about understanding in the context of a consultation, we mean an understanding of the patient's perspective. This doesn't mean you know exactly what it's like to be in the patient's shoes, but you understand what their perspective is and why it may be that way. When we talk about empathy, we are referring to a shared understanding. This not only means that you understand the patient's perspective, but you have communicated it back to them so that the patient knows you understand. Only then can it be considered a shared understanding, otherwise known as an empathetic understanding or shared empathy. Rapport can be considered as a therapeutic relationship between the practitioner and the patient, built on a foundation of trust and open communication. If you have a good rapport, this helps to reach a shared understanding. You can think of a shared understanding and rapport going hand in hand. This is because if you don't have a good rapport, it will be difficult to reach a shared understanding. And if you don't have a shared understanding, you're unlikely to have a good rapport as a result. Empathy and communication encompass various different skills that we will look into shortly. But first, what is the difference between the two? Empathetic skills and communication skills are subtly different things. Verbal and non-verbal skills should be considered communication skills, which are also key in building rapport, but these aren't empathetic skills. Empathetic skills are in picking up signals from patients and interpreting them appropriately. These empathetic skills do need to be facilitated and reinforced by the use of good communication skills, but they are different. For example, you may pick up that a patient is embarrassed about a particular issue due to the way in which they are avoiding eye contact and speaking hesitantly. This would be an empathetic skill. You might then adapt the way you gather information from the patient based on this, and this would be using your communication skills. To establish a good rapport, you need these empathetic skills and communication skills. To help you differentiate the two, you can think of empathy as an internal and personal process, but communication skills as used in open expression between individuals. You can break empathy down into empathetic motivation, empathetic accuracy, and empathetic understanding. Empathetic motivation essentially means to genuinely care. You may be motivated out of a warm and caring nature or out of professional dedication. If you don't have empathetic motivation, it can be difficult to reach a shared understanding, and you may have to make a deliberate effort to focus on that patient in that particular consultation. In addition to motivation, a practitioner should have a certain set of skills to help them achieve a shared understanding. This highlights the difference between wanting to understand a patient and actually having the ability to do that. The specific skills are internal diagnostic skills that run alongside being able to judge clues from the patient. The practitioner needs to be able to make a sense of the clues and quickly decide how to respond. This can be called empathetic accuracy, as a good empathetic skill should lead to an understanding of the patient's perspective that is true and accurate. Empathetic understanding is about the effectiveness of the process we've talked about. In theory, if you've picked up on the patient's clues, responded appropriately, checked that your understanding is accurate, and communicated your understanding back to the patient, then you should have reached an empathetic understanding. Communication skills are required to communicate back to a patient that you understand. If you can't communicate this to a patient effectively, then the understanding is not shared. In other words, if you can't demonstrate to the patient that you understand their perspective, there is no reason for them to believe your advice and follow what you recommend. In terms of helping to establish a therapeutic relationship, communication skills have two main roles. They encourage patients to be more open, and they allow the practitioner to check their empathetic accuracy by checking what they have interpreted from the patient is true. A shared understanding can be considered as the end goal of an empathetic journey within a consultation. Rapport, however, is not an outcome per se, but more of a dynamic process. Rapport can fluctuate and needs to be worked on in a continuous manner. Having said all of this, sometimes you can do everything right, but there may be constraints on the development of rapport that are out of your control, and you shouldn't beat yourself up about this. For example, patients with autism can be sometimes more difficult to read, so interpreting clues may be more challenging. There can also be environmental factors, such as not enough time to discuss issues, which may leave patients frustrated. This video has tried to break down some of the factors involved in a successful consultation, focusing on the communication skills elements and the empathetic elements. Although these very much work closely together for a seamless consultation, we hope this video will be helpful when you have to support or give feedback to others where empathy may be an issue. Thank you for watching Consultations for Health. Don't forget to follow us on Twitter, like our Facebook page and subscribe to these videos.